I think it's most difficult when someone's very upset or agitated, when perhaps I first come into the ward.
You have a long-term relationship with people in general practice and you don't want to make them feel uncomfortable. You don't want to bring something up that's going to put them offside.
You are worried that you might embarrass them and you might make them feel uncomfortable, and that's certainly something that we don't want to do when we're trying to establish a rapport with our patients.
The last thing we want to do is add further stress to them at a time that's already quite anxiety-provoking.
Some clinicians don't think that a conversation with them about quitting smoking will make a real difference.
I was about 21 years old when I started smoking. Over the years I've seen lots of different doctors for various reasons, and nobody's mentioned smoking to me in any depth.
I had to seek medical attention, and it came up into the conversation that I was a smoker, and the doctor was disgusted with me and walked out of the room.
I can understand the doctor's point of view where they get tired of talking to you about smoking. You just need that support, to say, we can do this together. You don't have to do it on your own. That 1 minute conversation 20 years ago, 25 years ago, I personally feel will change my whole path.
A nurse spoke to me and took time with me and explained to me why I should give up and some strategies, and she spent a lot of time with me and it made a complete difference to my life.
I was in the hospital for days and everyone I came across was positive about that I could stop.
Eventually you think, I can do this.
Our patients and then the families really respect what we do. They are so dependent on the knowledge we've got and the care we give. And just that little effort to ask about smoking and encourage them to stop smoking for their own health, they take it seriously. That makes a difference.
When you bring up the topic with a patient of giving up smoking, you never know which one is going to be the one that takes it on board that day. And the one that does take the message on board, you'll change their lives forever.
I think it's really important that doctors should always address it with every person that smokes, because everyone that smokes needs to know what they're doing to themselves. It can make a big difference, life-changing.